Hello, my friends. My name is Dr. Michael Anderson. I'm 60 years old and I've spent over 3 decades working as a physician here in the United States, mostly with men and women in their 50s, 60s, and 70s. For many years, I practiced internal medicine at a community hospital in Ohio, and now I dedicate much of my time to teaching, writing, and sharing what I've learned with people just like you. Today, I want to talk with you about something deceptively simple: measuring your blood pressure. You might think it's just wrapping a cuff around your arm and pressing a button. But let me tell you, after seeing thousands of patients, I can assure you that small mistakes in this process can change the numbers in ways that truly matter. Sometimes by 10, even 15 points. That could mean the difference between being told you're fine or being placed on medication for the rest of your life. In this video, I'm going to walk you through the most common mistakes people make when checking their blood pressure and how to avoid them. And I'll share stories, reflections, and lessons from real patients, so you can see how something so ordinary can shape your health, your peace of mind, and even your future. Mistake 1. Now let's begin with the first mistake, one that seems almost harmless: talking while you're taking your blood pressure. I remember a patient of mine. Her name was Margaret. She was 67, a retired school teacher, always full of stories and laughter. She came into my office one morning because her blood pressure readings at home were all over the place. When I asked her to show me how she measured it, she pulled out her little machine, strapped the cuff on, and, well, she started chatting away. She told me about her grandkids, her garden, even what she cooked for dinner the night before. And right there, as the cuff inflated, her numbers jumped almost 10 points higher than when she stayed quiet. Here's the truth. When we talk, even if it's just small talk, our body reacts. The sympathetic nervous system, what some call the fight or flight system, wakes up a little. The heart beats faster, the blood vessels tighten just slightly, and the pressure inside them rises. You don't feel it, you don't notice it, but the monitor does. 7, sometimes 10 points higher. Now I want you to think about that. Have you ever had a conversation that made your heart beat faster? Maybe a debate about politics, maybe even just recalling an old memory with a friend. That very same response is happening, even in gentle, friendly talk, when you're supposed to be resting quietly for an accurate measurement. And those numbers matter. If your blood pressure is recorded too high, even by just a few points, your doctor may decide you need medication. And once you start on blood pressure medicine, it often becomes a lifelong journey. On the other hand, if you're already on medication, those artificially high numbers might push your doctor to increase your dose, when in reality you don't need it. So what's the solution? It's simple, but it takes discipline. When you measure your blood pressure, make it a quiet ritual. Sit down, place your feet flat on the floor, rest your arm on the table, and then silence. No phone, no TV, no talking. Give yourself those 2 or 3 minutes of peace. Think of it as a small act of mindfulness, a chance to breathe and let the body settle. Margaret eventually learned this. A month later, she came back with a log of readings done in silence. And you know what? Her blood pressure was much better than she thought. No new medication, just better habits. Sometimes, health begins not with a pill, but with a pause. Mistake 2. The second mistake is one I see almost every week in my clinic: sitting the wrong way during the measurement. Let me paint a picture for you. A gentleman named Robert, 72 years old, came in for his routine checkup. Strong fellow, used to be a carpenter. When I asked him to sit down for his blood pressure, he crossed his legs, leaned halfway off the chair, and rested only 1 foot on the ground. The monitor beeped, and there it was, numbers that looked alarmingly high. So I asked him to uncross his legs, place both feet flat on the floor, lean back, and just breathe. We repeated the test. The difference? 10 points lower on his systolic reading. Same man, same heart, just a different position. Here's why. When you cross your legs or let your feet dangle, the muscles in your legs and core tense up. That tension, small as it feels, pushes blood pressure higher. When your back isn't supported, the body strains ever so slightly to hold you upright, again triggering a rise. And these little changes add up. 5, 10 points, enough to change the story your numbers are telling. I want you to imagine this. You're about to climb a hill. If your feet are steady on the ground, you feel balanced, strong. But if you're standing on uneven rocks, your whole body tightens, every muscle working harder just to stay stable. Measuring blood pressure works the same way. Your body needs stability to give an honest answer. So here's my advice, from years of watching patients like Robert. Before you check your blood pressure, sit as if you were preparing for a quiet conversation with yourself. Back against the chair, shoulders soft, both feet grounded on the floor. Let the chair hold you. Let the earth hold you. And remember this, health isn't only in the medicine we take, but in the posture we choose, even in something as simple as sitting down. Mistake 3. The third mistake is subtle, but I promise you, it happens more often than you think. It's resting the arm too low, or letting it hang at the side instead of keeping it at heart level. I once had a patient, Linda, 65 years old, who was very diligent about tracking her blood pressure. She brought me a notebook filled with daily readings, each one higher than the last. She was worried, her daughter was worried too, that it was time for stronger medication. But when I asked Linda to show me exactly how she measured at home, she sat on the edge of the chair and let her arm dangle down, the cuff far below her heart. We tried it together in my office. First, arm hanging down, 150/90. Then, with her arm resting gently on a table at heart level, 138/82. Same machine, same woman, but a 12-point difference, simply because of gravity. Think about it. Your heart is the pump, and your arm is the hose. If the hose is lower than the pump, the pressure reading will always be higher. It's basic physics, but in practice, it can be the difference between being labeled hypertensive or controlled. So here's what I tell all my patients. Give your arm a place to rest. A sturdy table, a cushion, or even the arm of a chair. Anything that keeps it level with your heart. Your muscles should be relaxed, not straining to hold the position. Because when the body is at ease, the reading is honest. And maybe there's a lesson here too. Life often gives us truer answers when we meet it at heart level, not when we strain or hang low. Mistake 4. Another mistake I see far too often is this. Taking your blood pressure right after exercise, a cigarette or a glass of wine. Now I understand why people do it. You finish your morning walk, you sit down with your cuff, and you think, this is the perfect time. Or maybe after a stressful day, you light a cigarette, pour yourself a drink, and then, out of curiosity, you check your numbers. But let me tell you a story. A gentleman named Robert, 58, came into my clinic convinced he was on the verge of a crisis. His home readings were all over the place, sometimes 170, sometimes 160, never stable. He looked anxious, restless. When I asked him about his routine, he admitted, "Doc, I usually check it right after my jog or after a smoke in the backyard." We ran a little experiment. I had him sit quietly in my office, no phone, no distractions, just breathing easy for 5 minutes. Then we took his pressure. The number? 138/84. Still something to watch, but nowhere near the numbers that terrified him at home. You see, exercise, smoking, alcohol, they all temporarily raise blood pressure. That spike isn't a lie. It's your body reacting, but it doesn't reflect your baseline. Measuring during that moment is like judging the weather during a thunderstorm. You'll never see the clear sky. So here's the simple fix. Wait. Give yourself 30 minutes after exercise, after that cigarette, after that drink. Let your body settle. Let your heart find its natural rhythm. Then measure. And maybe, beyond the numbers, there's a wisdom here too. Sometimes in life, the clearest truths come not in the rush, but in the pause. Mistake 5. One mistake I often see, even among people who are trying their very best, is checking blood pressure over and over again, without giving the body a chance to rest between readings. You might be surprised how common this is. Someone takes a reading, the number feels too high, so they pump the cuff right back up, and then again and again. By the third or fourth time, they're sweating, frustrated, and the numbers only climb higher. I remember a patient, Mrs. Helen, 65 years old. She came to see me with a notebook full of numbers that looked like a roller coaster. "Doctor," she said, "I think my machine is broken. Every time I check it 3 or 4 times, it just keeps going up." So I asked her to show me how she did it. Sure enough, she wrapped the cuff, pressed the button, got a reading, and immediately repeated the process. No pause, no breath. What's happening here is simple. Your arm is under stress. The cuff squeezes tightly, restricting blood flow. If you inflate it again right away, your vessels haven't had time to relax. Imagine holding your fist clenched for several minutes. It gets tighter, more uncomfortable, and less accurate as time goes on. That's what you're doing to your arm when you measure back to back. So here's the better way. Take one reading, then stop. Breathe, rest your arm. If you want to double check, wait at least 1 to 2 minutes before trying again. And if you want the most reliable picture, take 2 or 3 readings spaced apart, then average them. It's not just about the numbers, it's about patience. And in a way, that's a lesson for life too. Clarity often comes not when we push harder, but when we pause, give things space, and let the truth reveal itself. Mistake 6. Another mistake I see quite often is something that seems small but makes a world of difference. Sitting in the wrong position while measuring blood pressure. You might not think posture matters much, but it does, more than most people realize. I'll never forget one of my longtime patients, Mr. Johnson. He came into my office with his machine, puzzled because his home readings were always higher than what I found in the clinic. So I asked him to show me. He sat down on the edge of the chair, legs crossed, cuff dangling down at his side. In that position, his numbers shot up. But when I asked him to sit back, place both feet flat on the floor, rest his arm at heart level, and relax his shoulders, the reading dropped by nearly 10 points. Same man, same machine, same arm. The only difference? Posture. When you sit with crossed legs, it can raise your pressure. When your arm hangs below heart level, it changes the numbers. Even tensing your back or leaning forward can alter the reading. Blood pressure is sensitive. It responds to how your body is aligned. So here's the best practice. Before you measure, sit in a chair with good back support. Keep both feet flat on the ground, not crossed. Place your arm on a table or armrest so the cuff is at the same level as your heart. And take a moment to relax, shoulders down, breathing naturally. These adjustments may sound small, but they're not. They're the difference between chasing numbers that don't reflect your true health and getting a picture you can actually trust. And I often remind my patients, posture in life matters too. The way we carry ourselves, whether tense and restless or calm and grounded, can change how we experience the world, just like it changes how the numbers show up on that little screen. Mistake 7. Another mistake I often see is something we all do without thinking, talking or moving while taking a blood pressure reading. It might feel harmless. You're just answering your spouse's question or shifting in your chair, but even small actions can throw the numbers off. I remember Mrs. Taylor, a lively woman in her late 60s. She loved to chat, even while the cuff was inflating on her arm. One day she showed me her log, and the numbers were consistently higher than expected. So I asked her to take a reading in my office. As the cuff tightened, she started telling me a story about her grandchildren. The machine beeped. Her pressure was 12 points higher than usual. Then I asked her to sit silently, hands resting, feet still. We repeated the reading. This time, the numbers dropped back to her true baseline. She was astonished. "Doctor, She laughed. "Are you saying I need to stop talking for once in my life?" And I said, "Only for 1 minute, Mrs. Taylor. Just one quiet minute." Talking engages your muscles, changes your breathing, and slightly raises your heart rate, all of which affect blood pressure. Even subtle movements like shifting in your chair or tapping your foot can change the reading. So here's my advice. When you measure at home, treat it like a moment of stillness. Sit comfortably, keep your feet flat, place your arm at heart level, and stay quiet. Don't check your phone, don't answer questions, don't even whisper. Just breathe and let the machine do its job. And you know, there's a lesson here beyond medicine. Many of us spend our lives in constant motion and chatter, but sometimes the most valuable truths, whether it's your real blood pressure or your own inner peace, only appear when we allow ourselves a little silence. Mistake 8. One of the most common mistakes I see is trusting a single blood pressure reading as if it were the absolute truth. People often take one measurement, jot it down, and then carry that number like a verdict. But the truth is, your blood pressure is like a river. It flows, it shifts, it never stays perfectly still. I think of Mr. Jenkins, a retired teacher who came into my office worried sick because his home monitor had shown a reading of 170/95. He was convinced something terrible was happening. But when I asked how many times he had checked, he said, "Just once, doctor. The number scared me too much." I had him sit quietly, breathe, and we took 3 readings, 1 minute apart. The first was high, yes, but the second was lower. By the third, his numbers were nearly back to his usual range. That first reading had been a false alarm, caused by nerves, movement, or just the natural ebb and flow of his body. That's why guidelines from organizations like the American Heart Association recommend taking 2 or 3 readings, spaced a minute or 2 apart, and then averaging them. This helps filter out those little spikes and gives you the truest picture of your blood pressure. So if you measure at home, don't panic at the first number you see. Give yourself time. Take another reading, maybe even a third. Average them, and that will be your real story. And in a way, isn't that how life works too? One bad day doesn't define us. One mistake doesn't tell the whole story. Just like your blood pressure, the truth often reveals itself not in a single moment, but in the pattern over time. Mistake 9. Another mistake I often see is measuring blood pressure at the wrong time of day. Many folks will check it right after rushing in from the grocery store or immediately after finishing a cup of coffee. Some even do it the moment they wake up, still half asleep with their heart racing from the alarm clock. Then they worry because the numbers look unusually high or sometimes unusually low. Blood pressure, like the tides, has its rhythm. It tends to rise in the morning as your body prepares for the day, and it can spike after meals, caffeine, or exercise. If you measure at those moments, the reading may not reflect your usual baseline. It's just a snapshot of your body reacting to life. I recall a patient, Mrs. Thompson, who brought me a long list of morning readings, all higher than she expected. She thought her medication wasn't working. But when we added a few evening checks, after she had settled down, before bedtime, the numbers were much closer to normal. What she had been seeing each morning wasn't failure. It was her body's natural rhythm. That's why experts recommend picking consistent times to measure, often once in the morning before medications and breakfast, and once in the evening before bed. Avoid testing right after coffee, meals, or strenuous activity. By choosing calm, steady moments, you allow the numbers to tell the truth, not just reflect a passing surge. And maybe there's a gentle lesson here too. Life has its ups and downs, just like blood pressure. One heated argument, one stressful drive, one strong cup of coffee doesn't define our health. What matters is the pattern, the steady rhythm that emerges when we choose the right moments to pause, breathe, and check in with ourselves. So, my friends, as we've walked through these common mistakes, I hope one truth has become clear. Measuring your blood pressure isn't just about numbers on a screen. It's about paying attention to your body, giving yourself the gift of awareness, and respecting the quiet signals your heart and vessels are sending you. Over my decades in medicine, I've seen patients who learned to measure carefully and consistently, and it changed the course of their lives. They caught problems early, adjusted their habits, and gave themselves more years with their loved ones. And I've also seen the opposite. Good people frightened by a single rushed reading, or lulled into false comfort because they weren't checking properly. I want you to think of this practice not as a burden, but as a ritual. A moment in your day where you sit, breathe, and listen to both the cuff on your arm and the deeper rhythm of your life. If today's video gave you something to reflect on, I encourage you to subscribe, share it with someone you care about, and maybe start a conversation. Because health isn't just an individual journey, it's something we nurture together, family by family, neighbor by neighbor. Take care of your heart, my friends. It has carried you faithfully for decades. Let's honor it by paying attention, one mindful reading at a time.